Hello, everyone. My name is April Moody, and I'm in NU 675, and I'll be completing a video of the patient number 2 and the Unit 10 assignment. First, I will read the case, and then I will discuss the way I would proceed with the visit. This is a 19-year-old married female with a 2-month-old baby, and for her 4th visit, her husband is present today. She presents today dressed up more provocatively than you've seen her before. Her makeup is heavier than usual. Her baby's in a carrier and is sleeping. She immediately starts discussing a video series on aliens and how she's been watching. Her speech is rapid, loud, and tangential. She makes several loose associations between the video series and her baby. From her rambling, it sounds as if she believes the baby is an alien and she needs to take it to the desert um, to leave it on the mountain for the aliens to come and retrieve. She reports making plans to go camping with her baby and her husband this weekend. Um, you question her about her suicidal and homicidal ideations, and she denies both. The husband states that she's been acting differently for a couple weeks. She's never behaved like this before, and he is scared to leave her alone with the baby. She interjects that she knows the secret to the world peace, and giving her baby back to the aliens will accomplish this. What are your next steps? Um, with this patient, I would ask her and her husband if he or she knew if she's ever been diagnosed or ever had a family history of mental illness. How she's sleeping, if she's sleeping, which it says the behavior's been going on for a couple weeks. Um, ask them if this has ever happened before. Um, with it being going on for at least two couple weeks, it would meet the criteria for bipolar disorder with the mania. Um, ask if there's ever been any times before that she's acted like this or went several days without sleeping or had any high highs or low lows. Also, explain to her, tell her, I understand that you believe that your baby is an alien and you may need to go camping, but probably need to put you in the hospital for a couple of days just to make sure that you and the baby are safe, making sure you're thinking clearly, and we could further evaluate you. I don't think at this point that she would be um, a candidate for a formal voluntary admission. I would feel that she needs to be PC'd at this point for further evaluation as well as for a coroner to evaluate. Um, this also one upon doing further assessment, I would with her being postpartum, I would want to make sure that there are no other infectious um, diseases or ailments going on, infectious processes going on, um, and perform some lab testing just to make sure there's no medical cause for the psychosis. Also, you'd want to consider postpartum psychosis, as usually that happens within the from anywhere from a couple weeks after to up to 8 weeks postpartum. With that, also admitting her to the unit, you would want to give an antipsychotic or administer some lithium, maybe with an a depressant. Also, you would want to assess if she is breastfeeding, because with breastfeeding, it would contraindicate with the antipsychotic medications or the lithium. And at that point, you would have to, determine whether or not um, the benefits outweigh the risk with that in this situation.